Good morning, everyone. This is Bill Keegan, Town Manager in Foxboro, calling with your COVID-19 update. Um, Sorry for the delay in getting out to you this morning, but I had a couple other meetings I had to get to this morning. But here's the latest information on what's been happening in and around Foxboro, and the numbers look like this morning. So from March 15th, we have had 95 confirmed cases. We've had 65 people recover. Total of 22 are currently active, and a total of 7 have been lost in the follow-up process. So those are that's the latest information in terms of what's happening in Foxboro. A total of 532 individuals have tested negative, which is good news. And then also the number of hospitalizations remains at 3, and that has stayed steady for about 3 weeks now, 2 weeks now, and we're heading into the third week. So in and around the state, Norfolk County is currently at 6,952 cases. Total of 650 people have died as a result of COVID-19 complications. A total of 77,793 cases have occurred in Massachusetts, and a total of 388,389 have been tested. Almost 390,000 cases have been tested in Massachusetts. Right now, 17,900 COVID beds, available beds, are here in Massachusetts. 3,104 are the total people actually occupying those beds at this point in time. And 814 people are currently in ICU as a result of COVID-19 complications, and which is actually coming down. So that's a good trend in the right direction. So we've been watching that very closely for the past several days, and those numbers are coming down. So that's a good sign and a good steady sign that we've been waiting for. So let's go right to the report this morning. The CDC has issued guidance for reopening America. Here are some of the points. The full document is available at cdc.gov/coronavirus/community-reopen-guidance.html. So the guidance is intended for all Americans, whether you own a business, run a school, or want to ensure cleanliness and safety of your home. Reopening America requires all of us to move forward together by practicing social distancing and other daily habits to reduce our risk exposure to the virus that causes COVID-19. Reopening the country also strongly relies on public health strategies, including increased testing of people for the virus, social distancing, isolation, and keeping track of how someone infected might have infected other people. This plan is part of the larger United States government plan that focuses on cleaning and disinfecting public spaces, workplaces, businesses, schools, and can also be applied to your home. Cleaning and disinfecting public spaces, including your workplace, school, home, and businesses, will require you to develop your plan, implement your plan, maintain and revise your plan. Reducing the risk of exposure to COVID-19 by cleaning and disinfecting is an important part of the reopening public space that require careful planning. The virus that causes COVID-19 can be killed if you use the right products. EPA has compiled a list of disinfectants, including products that can be used against COVID-19, including ready-to-use sprays, concentrates, and wipes. Each product has been shown to be effective against viruses that are harder to kill than viruses like the one that causes COVID-19. This document provides a general framework for cleaning and disinfecting practices. The framework is based on doing the following. Normal routine cleaning with soap and water will decrease how much of the virus is on surfaces and objects, which reduces the risk of exposure. Disinfection using EPA-approved disinfectants against COVID-19 can also help to reduce the risk. Frequent disinfection of surfaces and objects touched by multiple people is important. When EPA-approved disinfectants are not available, alternative disinfectants can be used. For example, 1/3 cup of bleach added to 1 gallon of water, or 70% alcohol solutions. Do not mix bleach or other cleaning disinfection products together. Bleach solutions can be effective for disinfection up to 24 hours. It's important to continue to follow federal, state, tribal, territorial, and local guidance for reopening America. One thing that's really important for you to know is that we just met this morning. That's the reason why I was running a little late. Is that I was finishing up a meeting on this on this very topic and getting out there to work with our various departments and trying to develop our plan for reopening town hall and the library and senior center and all the various locations associated with town halls, the Foxboro's town government. So we are actively working on those plans, which include a lot of the items that we've just talked about. A few important reminders about coronaviruses and reducing the risk of exposure. Coronaviruses on surfaces and objects naturally die within hours to days. Warmer temperatures and exposure to sunlight will reduce the time the virus survives on surfaces and on objects. Normal routine cleaning with soap and water removes germs and dirt from the surfaces. It lowers the risk of spreading COVID-19 infection. Disinfectants kill germs on surfaces. By killing germs on a surface after cleaning, you can further lower the risk of spreading the infection. Store and use disinfectants in a responsible and appropriate manner according to the label. Do not overuse or stockpile disinfectants or other supplies. This can result in shortages of appropriate products for others to use in critical situations. Always wear gloves appropriate for the chemicals being used when you are cleaning and disinfecting. Additional personal protective equipment, PPE, may be needed based on the settings and product. For more information, you can look at the CDC's website on cleaning and disinfection for community facilities. Practice social distancing, wear facial coverings, and follow proper prevention hygiene, such as washing your hands frequently and using alcohol-based, at least 60% alcohol hand sanitizer when soap and water is not available. If you oversee staff in a workplace, you should plan to include considerations about the safety of custodial staff and other people who are carrying out the cleaning or disinfecting. These people are at increased risk of exposure to the virus and to any toxic effects of the cleaning of clean chemicals. These staff should wear appropriate PPE for cleaning and disinfecting. To protect your staff, to ensure that these products are used effectively, staff should be instructed on how to apply the disinfectants according to the label. For more information, concentrate on concerns relating to cleaning staff or visit the Occupational Safety and Health Administration's website on control and prevention. So those are the latest updates that we have, mostly associated with the reopening steps that we're working on right now, which affect everyone, and want to make sure that you all are aware of the same things. It's more of the same. I mean, we can't emphasize it enough and we're sorry that we have to keep saying these things, but it's really important that everybody hears them consistently, and that is the same guidance that we've been trying to offer since day one, is to wash your hands more often, use face masks when appropriate, keep 6 feet apart, disinfect whenever possible, and use the right products that are out there. And those are the latest updates on what's happening on that level. So just one other thing I wanted to bring to your attention, and that is the fact that for Memorial Day, we are not going to be able to do the normal Memorial Day type of celebration that we typically do. However, this year the Veteran Service Department will be doing a live ceremony. We'll be doing a pre-recorded Memorial Day ceremony and cemetery ceremonies that will air on Memorial Day, Monday, May 25th. You can help honor and remember by hanging your flag, placing a light in your window Sunday, May 24th through Monday, May 25th, and or creatively decorate your front door, yard, bikes, etc. And send a picture or video of your display honoring and remembering by Monday, May 20th to the Veteran Service Department at veterans@foxboroma.gov to be incorporated in the ceremony. The Veterans Department is respectfully requesting that your submission do not include Happy Memorial Day. To properly observe phrases such as I remember, we will not forget, and honor and remember are encouraged for those submitting the photos and videos. If there are any questions, you can contact the Veterans Office via email or call 508-543-1204. More details can be found on the town and Veterans Facebook pages, as well as the Veterans page on the town's website. And then the other thing that we just wanted to let people know is that they are making appointments they've made appointments. You can't register any further, by the way, for the collection of the household hazardous waste. That should be happening going around today, and companies should be doing that, picking up that information, that material for you. By now, if you haven't made an appointment, unfortunately, you can't make one now. It's too late in the process. So, but we do appreciate we had a good run of people make appointments. So we appreciate everybody's cooperation in making that happen. And so actually, so it is a beautiful day. Hoping people can get out and get a walk in. There are some thunderstorms later this afternoon, so it's a good time to get out and walk. And if you're going to do it this morning as opposed to this afternoon. Enjoy the good weather while you can, and I hope that you're all staying healthy, staying well, and we'll continue to keep you updated on what's happening. Again, a trend setting in the right direction, as from what I can see now. The numbers are heading in the right direction now, finally. They were stubborn for a while, but it looks like things are starting to come around, and we're starting to go in the right direction. So let's continue on that right track, and hope everybody continues to stay healthy and well. And I'll see you again back here tomorrow morning in around 10 o'clock for your latest update from the town of Foxboro. Hope you stay well until then. Talk to you then.